Aaron, I have the stream up on Facebook.
Bryce, how you doing?
I'm all right. Some lingering symptoms, cough and congestion, but getting better.
Good.
Congratulate Mrs. Brimmer for her kiddos win of the spelling bee. Oh, yeah.
All right, it's 6 o'clock. We'll go ahead and call this special meeting of the USD 417 board to order. Introductions, I think we all know who we all are. We'll forego those tonight. Jump right into the action item and the district masking policy.
Okay, a couple things want to kind of got to go through in a sequential order here. So first, we'll start with we need to talk about the matrix, the scorecard that we have developed, bring for approval tonight. We need to talk about our existing policy that's in place for masking for unvaccinated staff, and then we also need to go over some communication we need to put out to families and community about just preparedness recommendations, and then also a letter Mrs. Reddick developed today to go out to parents, kind of explaining a little more in depth where we're at for the next 30 days under the new temporary suspension of the guidelines from KDHE and how that will apply to us. So probably tackle it in order first. Let's start with the scorecard. So here is the physical copy of the actual letter, and I'll pull it up online here. So we'll go to line C. So give me a second. Yeah. Okay, so here is a copy we're looking at now. This basically is the exact same thing we talked about in two previous meetings. The one you physically saw 2 meetings ago when we were at Council Elementary School. This one will just kind of goes through, and I'll let you read it. So in case you has any questions, but take a moment and read through it. And then I can kind of explain the details of it after you've had a moment to read through it. So what this is saying then is that we will use our active positive cases on Thursday night. Dana will upload those to the scorecard, which we'll go through next. The percentage then is generated from the formula of the number of positive cases divided by the enrollment in that building. Enrollment includes staff and students, so total population of the building equals, and then times 100 to convert to a percentage. Then gives us the following data to determine whether it would be in mask or not. So if the data falls within 0 to 1%, it would be green, which is mask optional. Over 1% to 2.99% would still be mask optional but encouraged, and then 3% or greater would be mask required for that following week. And then we do the same thing every Thursday night, publish it Friday for the following week. The admin team met and we looked through various forms of data with Dana. We discussed the number, how high, how low, where should it be, and everyone agreed 3%, probably the best starting point. And we can revisit that continually to see is that too high, too low, and we can make adjustments as we go. So with this being said, is there any questions over this particular document? So I pulled the scorecards, you can see how it will work when we plug it into the formula. Any questions over this right now?
Real quick, Dana, could you review, just because I know this is kind of a moving target, what does it take to move from, and if you are active, what would take you off that active list?
Yeah, so isolation of an active case considered in isolation is 10 days.
Okay.
So you would have to be out of that 10-day time frame to be off of the active list. So some that are starting to come back day 6 through 10 are still included on that active list time frame. So it is not until they hit day 11 that they come off the list.
Okay.
So let me elaborate on that, because the reason we chose to go active cases, because we looked at it two different ways. We could look at it as new cases that week. So basically on Monday, there's 2 new positives, right? Tuesday, there's 1 new positive. Wednesday, there's 0. Thursday, there's 0. That means on Friday, we'd say we'd have 3 new cases. If we did it that way, we talked about, we did the math for that. That's where we talked about you'd have a rolling 2 weeks. You've got to be out of the red for 2 consecutive weeks before you go back to a yellow or green. We thought that would be hard to explain due to the rolling 2 weeks and the number of cases that week. So basically, you're just doing a running total for that week of new identified cases. Then you still have these lingering cases, right? And so the cases that haven't dropped off yet are still there, but you're not counting them because we're looking at new cases. So we looked at it from this aspect of active cases. It's easier for Dana than just to say on Thursday, we have 5 active cases in that building. So if that puts us in red for that building, then they'd be in mass just that following week. And that takes care of having to do it for 2 consecutive weeks, because you're always accounting for those cases that have lingered, right? That they haven't dropped off yet. And you're accounting for new cases. So that makes it easier, we thought, to explain, because the fact that it encompasses everything instead of just looking at new cases only. But then that's where you need to go 2 weeks, because someone may come on Friday, they may not be out of isolation until the following week or the week after that, depending on their symptoms. So you got to count for 2 weeks of masking for that. So that's why we chose it this way to do active cases. We thought it would simplify the process somewhat.
Okay.
Then if you look at the scorecard, so that would be this. I didn't print it off because it's a live document. So this would be an example of what we would post. So this would be, for instance, for week 114 through 120. So it'd be that a Friday through a Thursday. So tomorrow's Thursday, January 20th. These are the total enrollments of the building, staff and students at this point. We won't change it, we'll leave it at that, because that's going to ebb and flow by a few numbers. It could get higher, it could get smaller, but we're just going to set it for where we're at and leave those numbers there. They'll be pretty consistent. And then the active cases. So for instance, we'll plug in, if Dana calls and says, hey, Prairie Heights has 2 active cases, you plug it in, that's 1.96%. So they would be in yellow, mask would be optional. Say Council Grove has 15 cases, elementary school, that'd be 3.57%. That's a red, they would be mask required the following month, starting on Monday. Council Grove Junior Senior High School, let's say they had, I'll do several examples so you can see how the color changes. So let's say they only had 2 cases, that's only 0.47%, less than 1%, they're in a green. And let's say it jumps up to 8 cases, that's 1.9%. They're in the yellow, masks are still optional. Say it goes up to 12 cases, they're 2.84%. Masks are still optional because they're in the yellow, they're under 3%. Say they have 15 cases, now it's 3.5%, they're in the red, masks will be required the following week. So that gives some latitude. So basically, if you look at what's the lowest number at 3% each building can have, you're looking at 2 at Prairie Heights, or 3, I think. We'll plug it in. Yeah, 3 at Prairie Heights. That puts them at 2.94%. 12 at Council Grove Elementary School, and 12 at Council Grove Junior Senior High School. 13 puts them just slightly over. So this was what we would publish in. We put data in on Thursday night after we got everything accumulated. Friday, sometime in the morning, probably before 10, 11 o'clock. So people have time to prepare. We publish this, send it out via our parent notification system. Post it on our website, our Facebook page. And then parents would know on Monday, you're either going to be mask optional or mask required.
Can you add an E after the word red? Require, on the very last sentence,
Yeah.
please.
Things been manipulated so many times. let's see, where,
Schools in red require masks, the very last sentence.
The other thing that I might make mention of, if you're looking like at our daily statistics on that Thursday, and you're like, okay, well, those numbers don't match those numbers, we have to account for some people in different buildings. So like, you might see, so like on our daily statistics, trying to think the best way to describe this. Some of them, like I might typically in my daily stats, I don't put them twice. So you'll only see them count as one number and show up in the Prairie Heights building when actually that's just where they're typically at. So in like these numbers, if this same person is going to Prairie Heights, but they're also in Council Grove Elementary, you might see those show up in both buildings. Does that make sense?
Yeah.
Because they will affect that building. But in the daily stats on the website, I don't want to skew that, making look like
there's more.
there's more than what there is. So on Thursday, if you're looking at this number compared to daily stats numbers, they may not match up completely, if that makes sense.
Dana,
Yes,
what are you using to define positive cases? Does that include home test positives
it will.
or people that are out sick with COVID-like symptoms that refuse to test?
Okay, so we
or
need to talk about that. That's on my list.
Okay.
We need to define
define what-
those who
who it
have
is?
symptoms but refuse to test. And my recommendation would be, we treat it just like the state treats a DUI, right? If you're pulled over and you refuse to breathalyze, it's a positive case. I think we have to show if someone wants to stay in school and they have COVID symptoms, they need a negative test. And if they refuse for that, that's fine. They just need to quarantine at home.
So a home test, positive or negative, the parents would send to Dana then, or how would that work? How would that communication go?
So for positives, we include them. If it's a home test and it's positive, the health department deems it a probable case. So we just go ahead and include that in our positive numbers.
Okay, so they wouldn't have to go through,
Not to
Again,
confirm
and
a
test.
positive, right? Now,
okay,
now I will say, if it's a negative, we do require a confirmation of that test,
okay,
to be able to come back to school earlier.
all right, thank you.
And the reason for those differences would be because we can't confirm whose test it was, right? So someone self-reports a positive, they're not probably gonna test themselves and say, hey, my kid was positive. But if we need a negative confirmation for something, then we need to make sure that that was the person tested for the negative test. So if they could use their home test, but they would need to bring it and have Dana administer it, or go to the health department, and have them administer it.
Okay.
But we just would not take a phone call saying, hey, we gave a home test and it was negative.
Sure.
So,
Okay, thank you.
questions on this part?
I'm sorry, I have one
No,
more.
sure, I'm sorry.
And I know you explained it, but I think it didn't quite register for me. So let's say there are 15 active cases, but 5 of those are in day 1 through 5 at home and not in the building. You're not gonna change that. It's still gonna be the 15
Right, we
Okay.
still do count them because
because
there's,
of the
Well-
work
Overlap.
it would be.
Yeah.
Okay, all right.
yes, yeah, and mainly because they still, even though they're not in the building then, they could have already affected children that are still in the building, so.
Okay.
So
we'll
think
count
about it
all
like
of
this,
those.
dude. Here's the thing that's hard for me to wrap my head around is, so technically, let's say a student comes in and tests on Friday and they're positive, but their symptoms started Wednesday. They just didn't report it. Well, technically, they could be back in school on Monday. They would never miss a day of school because Wednesday would be their start date for 5-day quarantine. So Wednesday, Thursday, Friday, Saturday, Sunday, they're back in school Monday. So they're a positive case, so they would never miss a day of school. They would be in our building the whole time under the new isolation. That's
Okay.
why we need to count them all until they fall off the list after
Okay.
10 days, because we just don't know where they're gonna fall at, where they would be at. Some may be at home, some may be in the building during that time, so.
Thank you.
All right, the next piece we need to talk about. Let me back up. This is the parent staff preparedness recommendations. Here is a copy of that letter, if you'd like a physical copy. This is just basically, we're asking parents to please have a conversation at home about this with their families, our guardians, about what would happen if, because we're gonna try our best to the last minute to find bodies, right? And so there won't be like a snow day where usually I try to make it a priority to notify parents plenty early on a snow day. That way they have time to prepare. for school to come out. We seldom wait till last, the 12th hour just because we don't want to put people in that situation. Weather is a little easier to do that because we usually collaborate with surrounding districts. You can get out and drive the roads. We know pretty much forecast, weather patterns and predictions from the National Weather Service. With this, we won't know. We may get a phone call from a staff member at 7 o'clock saying they just can't make it in today. We'll try to get subs, probably, until last minute. So we just are asking parents to kind of read through this, and we'll just go through them real quick. 1, be prepared for last minute notifications of grade school or grade level closures due to the availability of substitutes and other personnel, individual grade levels, or entire buildings may be forced to close for the day or longer at the last minute. So meaning we may have to call at 7:30 and notify parents that either the entire building's closed, or maybe if it's at an elementary school, just one section, maybe second grade, section B or whatever they're called, are closed for the day. And it would be a last minute. So we wanted to give parents that opportunity to start making preparations for if that happens, what do they do for childcare, and just be aware that that can happen. Number 2, same thing, only for bus routes. We'll try as hard as we can to get bus routes. That's typically a little earlier because obviously our buses leave earlier in the morning due to the distance they travel. But it may be a last minute notification where Bryce may be trying to find a sub at the last minute. We just can't. So we may cancel one route. If it's multiple routes, we may cancel multiple routes. So just be prepared for that. Maybe discuss alternate forms of transportation to try to get your child to school if we have to cancel the route. Probably the biggest one on this list is number 3, because we've changed so much. God bless our parents and our staff. We've gone from packets to remote learning to back and forth from choice to all kinds of things. And so now, though, where we're at now with the legislation about 40 remote learning being illegal, you can only do 40 hours. It is now we want to make sure parents and guardians and students at the high school level, especially understand they need to contact their teacher and make arrangements for work. Because we have left it up this year to the individual staff member to determine how they will handle that, whether it's letting a student remote in or letting a student just get packets of information to send home or whatnot. We left that up to the individual teacher to do. Some are very comfortable with the remote process and just say, yeah, remote in, no problem. Some classrooms that logistics don't allow for that as easily, and the teacher prefers to do it a different way. So we're telling parents to make sure they refer to their student's handbook. It's just like any other illness at any other time. If you have to miss school for being ill, you need to call and make arrangements with your teacher to figure out how you want that to be done. Dana can't do that individually for every parent. The building administrator can't do that for every child. It's up to the child or the parent to contact the teacher and say, okay, hey, I'm going to be gone for the next 3 days or 5 days. What are my options to get work, right, and work that out? So we'll make sure that's very clear, because I know there's some who it's just gotten so confusing because these policies have changed so many times throughout the last 24 months. Number 4, we do have abundance of hotspots available, so we'll make sure if a child does not have internet access at home, they can check that out of the school office. We'll have those in the school office, so parents, guardians can check that out for their student use. They are filtered, so they are for the child use only, not for general internet purposes. Yeah.
Quarantine is so bad.
Yeah.
Oh, thanks. I'll go through this. Is just a draft. No one's looked at it except for me. So this was done like at 1 o'clock in the morning last night. So let's see. Thank you though. The number 5, there are the new temporary guidelines that I sent you last night. About the temporary suspension for 30 days of a lot of the guidelines and recommendations. So we'll go over that next about what that looks like for us here in USD 417 and what we can still do and what we can't do just due to limited resources and limited personnel. So basically though, what we want parents to know for sure on this one are the 2 bullet points is that we will still diagnostic test if testing supplies are available. And that's a big if right now. KHDE informed us yesterday there are very limited testing supplies available now. So we'll see if they get more in and how that affects us, but we'll try to use those in a prioritized manner. So that will be if you're symptomatic and you want tested for diagnostic purposes, we'll try to accommodate that. If supplies exist, you can always go to the health department or hospital, but they're going to be in the same boat, depending on how their testing supplies are. So that will be available as testing supplies allow. Bullet number 2, we will still do the test to learn for quarantining for students who still come to school and staff to still be in school, so they don't have to quarantine at home days 1 through 5, but we'll limit it to 2 to 3 tests. Instead of testing every day, it will be a test maybe the first day, and maybe the third day, and maybe the last day. It won't be an everyday test like it has been. So, and that's for 2 purposes. One, they can't keep up and her team can't keep up. They just have too many kids in that process to do. And it doesn't make sense to have a kid come to school and sit in the hallway for 3 hours waiting to get tested and then maybe make 1 class by the time it gets done. And 2, testing supplies. Again, it goes back to how many supplies are available. Danny, anything you want to add to that?
No, I think.
And number 6, and these are things we need to discuss, but this is what the admin team thought was appropriate for recommendations to the board. Any outside visitors to the building need to follow whatever the masking guidelines are for that building that week. So if the building is in mask, visitors need to be in mask. If they're not in mask, visitors don't need to be in mask. But visitors must check in at the school office as they are always required. But we just want to remind them, we need to log that in case there is a positive case. We can notify that person who was exposed, or if that person becomes positive, hopefully they'll notify us. We can track where they were, what they did, and what they were in the building for, so we can notify parents if there was potential exposure. And with that being said, that changes to our notification system. How Dana and her team has been handling it, if there's a positive case, she physically calls every single close contact that she contacts trace, notifies a parent they were exposed, and walks them through what the quarantining guidelines are for that individual student. And then she also works with the health department in case it's a household contact and it needs to be taken a step further by the health department. That will stop now too, because Dana can't and Brenda and Barb can't physically call as many people as are on the list. So what we'll do now is we'll create a kind of a canned message, and then Dana will notify myself and the building principals of who needs to be notified, and we'll push that out through our parent notification system to the parent. And then if they have questions, they can call and get clarification. But instead of Dana making the initial contact, or Barb or Brenda, whichever building it's in, now we'll just push that out via notification system and have it laid out as best we can, but it'll be a generic reply, basically just saying, just be aware your child's exposed, please watch for symptoms, because we can't get too detailed for HIPAA, but we also want to make sure parents know they need to be watching for symptoms, and if symptoms develop, please contact your health professional immediately and notify the school office immediately. So that will hopefully alleviate on some of the phone calls and time that she's devoting to that. And then those who do need clarification are welcome to call for that. 7, any staff or outside visitors working with the students in the USD 417 pre-K program must wear a properly fitting mask. If not fully vaccinated, proof of vaccination will be required. So that's another thing we need to discuss tonight. Whether that's the desire to keep that in there, but the admin team felt that was necessary since our pre-K students have not had the opportunity to vaccinate yet. And that would be anywhere in the building. So if they go to lunch, if we have a lunch person who's not vaccinated, even though the building may be in green or yellow, they would still need to put their mask on while pre-K are in there if they're not vaccinated. If it's an aide working in that room, for maybe 1 class period covering, even though that aide may be the building may be in red or yellow or green, they need to wear their mask if they're not vaccinated for pre-K. Questions on this?
This isn't a question, but I just would like you to restate it so that people listening hear it again. But last minute can mean what?
Last minute can be your child's waiting out at the bus stop and you get a phone call saying, we're sorry, the bus driver is not able to pick your child up. That's a horrible worst case scenario, but we'll try the best we can to get, some days it may be easier because there may not be anybody in the substitute pool to call because they're already being utilized. And some days, if all the drivers are here, we may have some to call. It's just a matter of trying to get a hold of them. That's a pretty limited list as it is, but and substitutes for the classrooms, not just teachers, that's classified staff too. That's cooks, paras, aides, somewhat custodians, just depends. If our entire custodial staff's out, it's going to be pretty difficult to have school. We'll try, and we're working through alternate plans for how we do that, but it's pretty difficult if we've got a bunch of sick kids and one person throws up in the hallway and another person had an accident in the bathroom and, there's no one to clean it up, how do you get around that? So, but that'd be a last resort to council school for that, but that is a possibility. So yes, good question. Good
And I might
clarification.
add to, I know we've already talked about if supplies are available or not, but it really is at a point right now where we even have the doctor's office and hospital asking us to use some of our rapid tests on people because they're having to do send out tests. And so, which we're all helping each other out. So we're doing the best we can too, to get rapid testing on some of those individuals that maybe need an answer a little bit quicker. Otherwise, they're going to be having to do send outs that may take 3 or 4 days sometimes. So those kiddos that are sick and waiting on testing, we may see more, longer absences because of having to get results. Right now, I figured out this weekend, we had done 262 tests last week in our school district. So that was our PCR and antigen tests all together. We have about somewhere between 400 and 500 antigen tests left right now. And this is estimates right now because we've been testing since we came back this week, but our rapid PCR tests, we probably have about 60 maybe left, maybe 50 to 60. So if we continue the testing trend like we have been, we may looking at only a couple of weeks worth of testing supplies left. So we'll have to see what the state comes up with in the next few weeks.
And right now, KDHE informed us yesterday in a briefing that they're out of test. There's 400,000 tests were lost in shipment and they don't know where they're at. And as of now, they said we won't get any more tests before earliest be February is what they thought. So is what it is. All right, questions on this? All right, and then the last document we need to look at is the letter that we will send out to parents, and here is a copy of that. And I take a moment, read through it. Just kind of reiterates everything we said up to this point as far as the testing guidelines go and explaining why that is.
Aaron.
Yes, Marie?
Now that we've gone through all of these, I wondered if we might backtrack a minute and go back to that 2021, 2022 masking guidelines. In the second there where it says based on the formula, it says schools. Should we change that to buildings?
Okay, yeah, that's fine. That makes sense. And then on the back of this is just those 2 bullet points. Again, that were on the preparedness recommendation list. Which can never put it out there too many times. The more people can have the opportunity to read it, the better it is. Thoughts, comments, concerns, suggestions? Danny, do you have anything else you want to add to it?
I don't think so.
Chris, do you have anything you want to add? Heather, you online? There you are. You have anything you want to add?
Comments, questions?
What's the thoughts on those who refuse to test but have symptoms? Everybody okay with us either requiring a test or sending them home until symptoms are clear?
But that part, we definitely have already been doing. It's just, are we gonna count them in the numbers? Considered a probable case or not? That's what our health department was asking today.
I think if we send them home because of refusal to test, we have to count them, assume they're positive. I mean, hopefully they'll agree to test. It's a non-invasive test now, so I'd understand if it was the high nasopharyngeal scan test, but swab, but now they're being non-invasive. It can be done unless there's a medical condition preventing it.
Yeah, I think we have to just assume, or just not assume, but call that a probable.
They have the opportunity to negate it if they choose. It's a choice they're making to not test. And we'll honor that. We just have to send them home for the safety of everyone else. Yeah.
What if a child sees a physician and they get cleared, but the physician doesn't deem a COVID test necessary? And they say, well, and let's say they, there's so many scenarios. Physician says, no, it's just a common cold. It's not COVID, it's not the flu. And you get a doctor's note. What happens then?
Yeah, so usually we would not count that. I mean, if a doctor writes it as a different diagnosis, then we deem it whatever that diagnosis is written.
I don't know how
There's
the
100 million scenarios.
yeah,
I mean,
I don't-
Right.
doctors know their patients better, but and especially if it's a regular doctor, but I don't know in today, the way it is now, so many symptoms are duplicate symptoms. I wouldn't go, I hope the doctors do due diligence and are thorough. And so they don't jeopardize others.
I'm just curious, I can see it coming up.
Yeah, absolutely. I think at this point, we would require a test. It'd be probably an individual basis, but if a student came in and says, hey, I have seasonal allergies every year, this has been a pattern, and they just have sniffles, know their symptoms, I think that it'd have to be a case by case, but I think in the general practice, you require a negative test. Is that, what's your thoughts on that?
Yeah, I mean, the way we have kind of from the beginning with this, because you can have, I mean, you can have a runny nose just from walking outside in the cold. So, we, just to try and make it a little bit more black and white, we had, these last couple of years, we've done 2 symptoms or more. Now, right now with Omicron, it seems like, we are having several testing positive with even just the 1 symptom. So it is tough, but we've just tried to take it case by case and see what's typical for that person. I feel like we know the kids and staff well enough that we know if we're typically seeing them for allergies or, different things. So
Probably easiest policy to establish would be that we require a negative test, but we give Dana and her team the discretion on an individual cases to deal with individual family. But if she tells a family member they need a test, we back that up. 'Cause I trust her and her team, and they, every positive effort, like she said, she knows kids. She knows, and her judgment, I trust, her team's judgment, I trust, so.
All right, what else?
And then the only other thing, we assumed as we created this, we were talking about pre-K through 12. Just want to make sure that palatable to everybody, that if the building's masked, and so is pre-K. As of, which was a mandate, the mask mandate in the county, it did not include pre-K. If the building's masked, though, Councilor Elementary, MNT's recommendation is that it should be pre-K through 6 in that building.
Are you wanting us to approve this as an entire package?
You can do it either way. Yes, you can just approve all documents and policies
Yes.
discussed tonight.
One question,
Sure.
is the 3% or greater subject to change later on as we learn more?
Mhm.
Okay,
Absolutely.
because five kids positive, that can sometimes be half a class, if not more. So that's why I was wondering that.
I think that's the starting point, and then we just have to continue the discussion, continue looking at the data and see, is it too little, too much, and adjust as we go.
Great question, Miles.
Mr. President, I move we approve the district masking policy in its entirety as presented by Mr. Doty this evening.
All right, been moved and seconded that we approve the district masking policy as presented this evening in its entirety. Additional discussion on this item? All in favor, raise your right hand. All opposed? So passed.
The last thing we probably should address is the policy passed in June. We probably need to revisit that and update it. Now that, obviously, a lot has changed since then. So let me go to our webpage and pull that up. That's the most recent copy. And you remember where it should be on the code information, right?
Yeah, it was under
There, no, the flow chart.
Can I make a operation guideline, is that what it's named?
I'm new to this fancy
Let me pull
meeting
it up
stuff,
here.
so if we need to adjust that percentage, do we have to have a special board meeting then to talk about it to approve that percentage adjustment?
Say it again.
If we change the percentage, would we have a special meeting to do that?
If it's outside of the regular board meeting already scheduled, then yes.
Okay.
So every regular board meeting you can discuss and change it. But if we meet
I'm just
outside of
thinking
it.
like in 2 weeks, we realized that 3% was way off or something.
So the way it works, either the board president, myself, or 4 more members can call a special meeting. So, Terry, you could call Terry and say, Mr. Pound, say, hey, I think we need to have a special meeting, look at this. You can call me and then I could relay to him, or and if I say, no, I don't think we need one, he says, no, I don't think we need one, but 4 members still we do. And they request it, then we have a special meeting. We just got to notify the public. For the new board members, one thing, there's a waiver of rights. Bryce, did have they signed that?
Yeah.
Okay, so I need to have you sign, there's a 2-week notification of any special meeting. What it does is prevent everybody from going, oh, hey, Terry can't be here tomorrow, so let's have a special meeting, right? So, but also, it also limits you then from being able to, sometimes we'll have a meeting and we'll say, hey, we need to talk about this. Let's turn right around and have another special meeting. Because you can't have a meeting outside of what we notified the public and when we set our regular meeting dates, and it's a special meeting. So when you call a special meeting, you as board members have a right for 2 weeks of notification prior to that meeting, unless you waive your rights for that notification. So that's why everybody usually just signs that so we can schedule a special meeting anytime we need to without having to wait 2 weeks to do that. So
2 days.
2 days, yes, sorry.
We'll send those out electronically. You'll get an Adobe sign sheet. And then you'll see the document when we've all signed it.
Bryce, do you know where that was on here? I know it was, where?
We took it down because it conflicted with what was approved at the regular meeting last week.
Okay. All right, let me go find a copy over here. So basically what the policy that was approved in June, I believe, July of last year, or maybe beginning of August, was masks were optional unless we're under a mask, a county, state, or federal mandate. And then the piece in there though required masking of non-vaccinated staff if they are around students for longer than 10 consecutive minutes. But that's changed as well because now it's 15 cumulative minutes throughout the whole 24-hour period. And now that we are in a matrix we need to visit that, because technically under that policy, if the building's in green or yellow, mask optional, and the staff member is not vaccinated, they would have to mask under that. So we need to revisit that and make sure we have that updated and clarified. So why I look for that, you guys can discuss what your thoughts are on that.
It's in the August 9th regular meeting. It's not in the agenda, it's attached as a separate attachment.
Very sure to file in the chat. I don't know if that, you never know. I can't text.
Here, you want this one?
Thank
Okay.
you.
Yes, it is that. There you go.
Okay. Make sure this is the most recent version. Yep. Okay. So this is what we had to publish for ESSER and to make sure we're in compliance with all federal regulations for ESSER funds. And this is where we established our masking policy over the summertime. So we need to address, of course, all this, it needs to be, basically, we need to just probably unadopt this policy and replace it with the current guidelines you adopted tonight. Because in 30 days, it could all change again. So it doesn't really do any good to go in and triage this. Yeah, well, it's changed 3 times in 72 hours. So
Right.
Dan and I were talking last night, and it's like, good grief, 3 times in 72 hours, we've seen different guidelines. And trying to decipher it all and put it together and then yet alone try to communicate it out is next to impossible.
So we just need to rescind.
Yeah, so I just end this policy and replace it with ones adopted tonight. And then as we go, we'll just keep updating it and making that our current official policy as you revisit the policy at whatever particular meeting we revisit on that.
Mike, are you ready? Mr. President, I move we rescind the USD 417 district operational guidelines that were approved at the August 9th Board of Ed meeting in lieu of the documents approved this evening.
So-
Yes.
So,
Hold on, let me get a second.
well, so what we need to do, just so we're still in federal compliance, we still need all this other part. So let's just include, replace the mask and contact tracing and quarantine section of this policy and the diagnostic screening and testing of this policy with the new adopted policy. Because this operation guideline still has to be in effect. So otherwise I'd have to go through and redo what you already did and add these bottom
All
pieces
the
to
other
it.
bottom.
Yeah.
Hygiene measures, the cleanings.
Right, somewhere.
Yeah, the bus one is on.
Yeah,
the,
the
Okay, I
bus.
thought I saw it.
Okay, so what I just heard you do was withdraw your motion.
Correct.
Okay.
All right, here we go again.
I know I read that.
Mr. President, I move we
Just say update the operational guidelines, the new policies passed tonight.
Yes. Yes, to include the hygiene measures, the cleaning of the facilities, vaccination, et cetera, and updating the mask and contact tracing and quarantine information. Yeah, it's just all this.
Crystal?
Is this where I second?
I
second that.
All right, been moved and seconded that we update the operational
Yes.
procedures, the operational guidelines with the items from this evening.
Yes.
I paraphrase that.
that's great.
Discussion or questions on that item? And you'll send those out to us, you'll send that document to us when it's done being wordsmith?
Yeah.
Okay. Any other discussion? All in favor, raise your right hand. All opposed? So passed. All right, what else?
That's it.
All right, well, with that, we will be adjourned. Thank you, everyone, for all your work. I know this was a lot for Dana, the administrators. We do appreciate all your efforts. in a very busy time anyway.
Thanks, guys.
Hey, Aaron, when does the
Oh,
thing go into effect,
so,
the scorecard?
yeah, so we need to continue masks until Friday, because we'll release the scorecard on Friday, which will take effect on Monday.
Okay.
So,
And I have another quick question. If we're in the red and we have activity events like a basketball game in that building, do all visitors need to?
Yes. Yes.
But then if, say, it's a tournament, a basketball tournament for little ones, would they then have to know what the guidelines would be for this building, that building, Prairie Heights?
so I think if it's outside usage, it goes back to what we did before, that those people are responsible for it. It doesn't involve us. They're liable for whatever they do in the building. If it's a school event or during the school day or a school sponsored activity, they follow whatever matrix is under for the building for that week. But if it's a youth basketball tournament that they're putting on up there, that's up to them. I don't want to get involved in trying to police and deal with that, because then we got to assign personnel for that day to be in the building and all that. It's just, it would raise their cost to rent it.
Terry's motion last Wednesday was to mask for 2 weeks while we got this ready.
Yeah, so we need to call a special
For 2
meeting.
weeks.
Yeah.
Yes.
Yeah,
Yeah, it was.
technically we adjourned, so does anybody want to make a motion to have a special meeting right now to expand the mask district mandate to Friday this week? Or you just want to give us authority to do that as building administrators?
Can we do that? Because if so, that would be that would make the most sense.
Yeah.
We even trusted you to do all this.
As long as there's a consensus. The only time you really need policy to back it up if there wasn't consensus, and then we can refer to policy, but if there's consensus, then it will be an issue because someone challenges it. We know the board will support that and back it up, and it's not an issue.
Right. I just wanna make sure.
Yeah. So everybody good with that till Friday?
Yes.
And then the matrix will be published on Friday and will take effect on Monday next week. So whatever color they're in is what they'll follow.
Yes.
Okay.
Thank you.
Awesome.
I love Robert Rule.
I was gonna say, I need to brush up on my fancy meetings.
Obviously, I do too.
But Robert's doesn't apply.
And just so you guys know too, anytime we call a special meeting, we can't discuss, like in a regular meeting, we can amend the agenda, right? During the meeting, and if something comes up, oh, hey, we need to add that to it. Special meeting, we can't discuss anything that's not published in the agenda. So if we do call one, there's something you want to discuss, make sure you get it out ahead of time so we get it on there.
Okay.
Because if it's not on there, once we start, well, after we publish it, notification, we can't change
Kelsey and Terry, I emailed back. My
Yep.
evenings are mostly free, so if there's a good time.
I'm thinking maybe that first Wednesday in February. I've got another meeting next week, so.
Is that the second then, Terry?
I think so.
Like at 6 again?
Yeah, I'll say you got
Or-
something tomorrow. I'll
Okay.
double check my calendar.
Talking about
with Aaron.
numbers.
That sounds good.
Aaron, we're still.
Love that we do.
Hey, Aaron. When you're updating those documents, I saw like on one of them, it had